Welcome to Rising Up for Justice, a special weekly series presented by Rising Up with Sonali, an independently produced, subscriber-supported program syndicated to radio stations, free speech TV, and podcast platforms. I'm Sonali Kolhatkar, host and executive producer. Our nation and our world is overrun by billionaires and bigots, but they are few and we are many. On this series, exclusive to subscribers of Rising Up with Sonali and viewers of Free Speech TV, we'll hear from organizers in the movements for social justice and dig into the nuts and bolts of values, strategies, tactics, narratives, and building power. And this week on Rising Up for Justice, Dr. PhilVerhoef joins me. He's an adult and pediatric ICU physician and clinical associate professor of medicine at the John A. Burns School of Medicine at University of Hawaii-Manoa. He's also the immediate past president and a national board member of Physicians for a National Health Program, which is what we're here to discuss today. He's also past president of the Illinois Single Payer Coalition, past president of the PNHP-Illinois chapter, and was faculty advisor for the University of Chicago Pritzker School of Medicine Students for a National Health Program chapter since its inception before moving to Hawaii in 2019. Welcome to the program, Philip.
Thank you so much. It's a real pleasure to be here.
So it's all in the name, Physicians for a National Health Program, but it seems that what sets PNHP apart is that it is the only physician-led national organization that is focused specifically on achieving single-payer healthcare, achieving a tax-funded universal healthcare system where everybody is covered. Is that accurate?
That's exactly right. We've been in this fight now for almost 40 years, and we were started by physicians, and over the years we have continued to grow. We now number over 25,000 physician supporters who believe that a single-payer national health insurance system is really the solution for assuring universal healthcare coverage for all people in the United States.
So an entire organization of thousands of people focused on achieving one simple thing that has a huge demand and a huge need. Sounds pretty straightforward. Well, how do you summarize
it would be,
what you have to do to achieve this?
Right. There's so much that we have to do. And if you were to ask the people that founded PNHP almost 40 years ago, if they thought that this organization was still going to be around 40 years later, they would have laughed at you. I've asked them that question and they've said, we figured that we'd be able to get this within a few years and there would be no problem. And then we would suddenly see that everybody in this country would have equitable access to healthcare. Because, of course, right now we have a healthcare system in the United States that leaves almost 30 million people without any health insurance at all. And that means they avoid seeking care. They can't afford to pay for it when they need it. And it means that we are literally hurting them in that context. And that's a real stark contrast to any other developed country in the world where they all guarantee health care for the people that live there. And so, we're really an outlier as a developed country. And so, what have been the challenges over the years? I think there have been so many. The barriers are numerous, not the least of which is the private insurance industry, right? They don't want this because they look at health insurance as a way to make money. But there's lots of other barriers too. It turns out physicians are not one of the barriers. The majority of physicians in poll after poll support a national health insurance program. But we're seeing more
Which I just want to interrupt you for a moment because we've
Sure.
often heard this logic from those who are against the system that, well, doctors will end up getting paid so much less and they're going to be the ones standing in the way because private health insurance ensures that they get paid enough for what the work they do. They then can pay off their student loans, etc. So you're saying that that's a red herring?
I think it's an absolute red herring. What we have right now for physicians is a situation where the doctors that we need the most, the primary care doctors, the pediatricians, your general internists, your family medicine docs, the people that are on the front lines of healthcare are actually getting really underpaid. They're barely able to make ends meet, barely able to pay off those student loans. And then the flip side is we have docs within certain specialties that you could make an argument that they're overpaid, that they are making a tremendous amount of money. And when we look at other countries with universal healthcare systems, those specialists are still very well paid. It's just that those countries support their primary care doctors much, much better. And so, at the end of the day, I think we'll see the majority of docs that we really need in this country actually being paid enough to be able to pay off those hundreds of thousands of dollars of loans that they have, to be able to support starting a private practice. But right now, that's not the situation that we have. And so I'd like to see a little bit more leveling of the playing field of, physician salaries. I mean, to be honest, no physicians in these other developed countries that assure universal health care, they're not starving. They are doing just fine. And there's no reason that we couldn't expect something similar in this country.
Let's talk about what it is that prevents this from happening. This is where we get into politics. This is where we get into the moneyed interests at stake, because it's not as though people are shelling out tons of money here in the United States out of pocket, even if they have employer-provided health care. It's not just a matter of being uninsured. It's often a matter of being underinsured. And yet, as you said, physicians are not able to necessarily make ends meet. A lot of the other health care staff, nurses and support staff are also in crisis. There's never enough staffing. They're overworked. And yet it costs so much money and the government spends so much money. Where is all that money going?
That money is going into the pockets of profiteers. And who are those profiteers? Those are people like the insurance industry, but it's also private equity, right? We're seeing more and more companies that look at the healthcare system as an opportunity to make a tremendous amount of money in one way, shape, or form. And let's remember that an insurance company or a private equity company, their whole goal, it isn't actually about care for patients. It's about assuring a bottom line for their shareholders. And, so the United States is unique because, nearly 40% of our spending in healthcare is going into private entities. If you look at other countries around the world, their healthcare spending is almost entirely within the public sector, but not in the United States. In the United States, we have enacted middlemen to get between the patient and the doctor, the patient and the hospital, and those middlemen, those insurance companies, those pharmacy benefit managers, those private equity organizations are literally pulling money out to line their own pockets. And that's been the real problem that we have. And then, of course, we know that with decisions like Citizens United now 15 years ago, there's really no limit on how much our legislators can be bought by these moneyed interests. And so we are seeing that get in the way of us being able to enact real common sense healthcare reform that puts the patient first and not profits.
Now, it's in the title that physicians want a national health program, which is the ultimate goal. But are there steps that can be taken toward it? For example, I know a lot of states have attempted to, or people, I should say, in states have attempted to get their states to enact single-payer healthcare. I'm in California. We've had bills come and go, and often it's Democrats who support it when they're not in power, and then mysteriously don't support it when they do have the power. Are there baby steps that can be taken towards single-payer healthcare, considering how just dysfunctional our federal congressional system is at actually getting anything concrete done?
I think that's a really good question. People may remember Canada's history, where in Canada they achieved effectively a Medicare for all national health insurance system, province by province. Famously, Saskatchewan was the first province to do it, and then the other provinces said, "Hey, that looks like a pretty good idea. Let's all do this ourselves." And then that led to the development of a national system. And so I think that it is possible that states may be able to figure this out. Now, there are some real challenges to states doing this as well. So, for instance, you literally need an act of Congress to create a state-based single payer that actually captures the revenue from Medicare, from Medicaid, from the Veterans Administration, right? From FQHCs, from all of the places, and commercial insurance, of course, from all of the places that provide revenue and spending within the healthcare system. And then I think there are other challenges too related to politics, related to the fact that states can't actually, generate their own revenue. They need to have balanced budgets, which is very different than the national currency, which in effect, if we need to spend more, we can print more. Now, that is an oversimplification of how financing works, but I think that's a challenge that states have. But I think there are actually other steps that we can take towards getting to a national single payer that don't just involve states. And I think one of them is, let's fix the Medicare that we already have. If you look at Medicare right now, it's a great program. And I'm not talking about Medicare Advantage. That is not a great program. But traditional Medicare, Medicare Part B, Part A, and then Part D for your drug benefit is good, but it's not perfect. People still have to get supplemental Medigap plans to make up what Medicare doesn't cover. And Medicare doesn't cover hearing and vision and dental and long-term care. Medicare doesn't have any limit on the out-of-pocket that you might spend. So you'd say, gosh, that sounds like a pretty problematic system. And yet it works really well for people. But let's fix it. Let's fix Medicare for the senior citizens that we have now. Once we demonstrate that we can do that, then we could expand it further, right? Another way that we can work towards a national single payer system in this country is to continue to fight privatization. Let's fight these Medicare Advantage plans. Let's deprivatize Medicaid, right? These are government programs where the government is literally paying money to these private entities to administer this government program. What are those private entities going to do? They're going to take as much as they can from it because their job is shareholder profits. It's not taking care of patients. And so let's fight against privatization within these government programs. People have talked about privatizing VA care. Again, I think that that's a dangerous, slippery slope that's going to lead to poor access and poor outcomes. So I think there are a number of ways, and PNHP is thinking about this all the time. What are the ways that we can fight? We know that we aren't going to get a single payer system tomorrow, but where are the battles that we should be fighting that will pave the way to us achieving the single payer that we know we need and deserve?
So it sounds like there's defensive battles that are being fought to preserve those spaces, limited spaces, where there is taxpayer-funded healthcare for veterans, for seniors, etc., in addition to the going on the offensive so that we're all covered. It seems as though some of the biggest challenges that PNHP faces are of a narrative and culture, depending upon who is pushing out the propaganda. You can unfortunately convince Americans that single-payer healthcare is not in their best interest. I remember as a young journalist covering those months before the Affordable Care Act was passed, where the so-called Tea Party patriots went on the offensive, and some well-meaning people were out there holding signs saying, "Keep the government out of my Medicare," not understanding that Medicare was a government-run program. There was all that talk of so-called death panels, and it was really quite disheartening to see how effective that propaganda was. And yet now you see poll after poll showing that there are majorities of Americans, and I suppose the numbers vary over time, who support a national health program. What is the cultural battle that PNHP wages on this front?
Oh, I think that's such a great point. Perhaps the biggest battle that we're facing now is we want to create a government-run national healthcare program, and yet I don't trust the government right now, right? I don't trust RFK Jr. I don't trust the Secretary of Health and Human Services to not completely mess that up. And so I think one of the biggest cultural problems that we've had is the absolute dismantling of trust in government systems, whether it's trust in the government insurance systems or trust in the science with the CDC or trust in any of the recommendations that are coming from our government. So that's a huge problem that we actually didn't have a few years ago, right? There's always been some baseline unfounded mistrust of government, but that mistrust now is at an all-time high. And yet, people still say, the majority of people still say they want a national health insurance program. So I think that we are dealing with that to such a great extent right now. And from a cultural standpoint, too, it's interesting. I think that people trust physicians, which I think is good overall. But again, we're seeing undermining of trust in physicians by the government right now. And I think that's a separate issue, right? You're hearing from government channels that maybe you shouldn't trust your physician about the safety of vaccines or about nutrition or about any of these other issues. So that's actually undermining our ability really to practice medicine. And I think another cultural challenge that at least PNHP faces is that physicians are kind of hard to organize. And I say that having been trying to organize physicians for the last 15 plus years. Physicians are busy. They went into medical school to take care of patients. They didn't go to medical school to get out there and advocate and go to the Hill and talk to legislators and try to understand policy and economics. And so, I think it's challenging to get a bunch of docs together to say, hey, let's fight for this. But on the other hand, we're seeing more and more physicians who are joining this fight, particularly in the wake of some of the challenges we're seeing now. You go to Minneapolis, and I talk to my friends there. Their patients aren't coming to see them because they're too scared, right? And now physicians are standing up and saying, look, our government is hurting us. It is keeping the people, both the citizens and non-citizens, from being able to access the healthcare that we all know that they deserve. And so that's another cultural challenge I think that we are dealing with right now too. And it's wild. These are challenges that are really unlike any that we've seen in the last 40 years of this fight. But, I will say there's more knowledge and awareness of a national Medicare for all type of system than there's ever been before. And I would credit much of the work of people like Bernie Sanders for getting this onto the national stage 10 years ago when he ran for president. People know about this. They may not know much about it, but they know that it exists. And the more that people hear about it, the more that they say, that sounds like a pretty good idea. Gosh, I don't want my health insurance to be tied to my employment. Gosh, I don't want to not be able to get health care just because I have a pre-existing condition. Wow, I don't want to have to pay all this extra money out of pocket before my health insurance kicks in. We
No,
can design a really
I
great
can
program.
I can bet that maybe you and I could envision a candidate running for president in 2028 who makes Medicare for all their biggest policy platform, their central issue, like a Bernie Sanders type. Unfortunately, seems like he might not be, young enough to run anymore. But making that their central issue, harping on it in a clear way, and winning quite stunningly, because it would probably resonate with the vast majority of voters, including conservative voters. And I think PNHP has made efforts to reach out to conservatives who seem to back single payer.
Yeah. And we're really working that now. We have our eyes on the next 3 years. The when you think about it, healthcare for all, Medicare for all, this intersects with really everything in American culture, right? Whether it's immigration and how we provide health care to people who are not from this country, reproductive justice, wealth inequity. Honestly, inequity at every level in this country, healthcare is a part of that, right? And it's not the only piece of it, but it's such a big driver for people. And so this is an issue that we know can appeal to everyone because frankly, everybody gets sick at some point. Everybody has to deal with our healthcare system. I think sometimes that we need every single person's story because I know that every person in this country has a story of a struggle that they've had dealing with our healthcare system, and it is a uniquely American story. And when you hear stories from people in other countries, they say, "This is crazy. I would never have to put up with this in my own country. I would just simply go and get healthcare." So I couldn't agree with you more. I think running on a Medicare for all, a healthcare for all platform is an absolute winner. And it's a winner economically, it's a winner for the workforce, it's a winner for people's dignity, for people's health. It's a winner across all the boards. And so we are absolutely working to develop our relationships with legislators, to organize with our allies, to try and build towards the 2028 elections and hoping that that's what we're going to see.
Now, who do you see as PNHP's natural allies within social justice movements? The universe of social justice organizing is huge, covering everything from climate change to abortion to, obviously racial justice and militarism. Where does PNHP's work, you think, fit in best?
Yeah, I think it's a great question. I think our first natural allies are, frankly, the labor movement. National Nurses United, NNU, has been an absolute leader in pushing for single payer Medicare for all. And obviously they're struggling with the fact that Alex Pretty was a nurse, was one of our own healthcare workers gunned down in Minneapolis, right? And so we work with CIR, which is the Council of Interns and Residents. This is a labor union for physicians in training. So we work very closely with them as well. But then beyond just healthcare allies, there are lots of other people lots of other organizations that share our goals, right? Whether it's Social Security Works, right, or Public Citizen. Some of these are
So organizations
Healthcare
that
Now.
are working on
These are all
preserving the social safety
organizations that
net.
believe in this. Yep,
Right.
absolutely.
And I'm wondering if you have any thoughts on how PNHP's work fits within abolitionist circles, right? Modern day abolitionists look at the money that we pour, our tax dollars that get poured into policing, which these days expands to ICE, and claim that if we divest from these law enforcement outlets that just harm us and instead invest in things like healthcare, we can all be better off. And so, do you see that working well as well?
Oh, I see that working well. PNHP tries real hard to stay in our lane as far as, we're docs and we know about the health insurance system, and that's what we focus on. But I think that this is part and parcel of a bigger vision that we can imagine for this country, a vision where people really have rights and dignity and are able to live and thrive. And, living in a police state is not something that any of us really want, to be honest. And so, I think as an organization, we try real hard to just focus on the things that docs are expert in. But frankly, I've learned so much about economics and about culture in my work as a single payer activist. And so personally, I support many of these other sort of expansive justice abolitionist movements that you talk about.
And so finally, what are the ways in which people can get involved? Do you have to be a physician to be involved with PNHP? Are there non-physicians who are, who see Medicare for all as their ultimate goal can they also join?
Yeah, and that's such a good question. You don't have to be a physician to join PNHP. We welcome anyone who wants to join in this fight. Now, you know you're going to be joining up with a bunch of docs, so for better or worse, you're going to have to deal with, physicians. But I will say that we have chapters in most of the states in this country. We have chapters in many of the medical schools through our Students for a National Health program, and we are out there. We are out there in the fight for any kinds of healthcare justice issues. You'll often find PNHP members there. And so I would encourage folks to reach out, find their local chapter, and see how they can get involved. But frankly, there's a lot of other organizations that are doing this kind of work. Healthcare Now is a fantastic organization, not run by physicians, but totally committed to a single payer national health insurance system. And so, there are a lot of different ways to connect to folks, but I would encourage people to reach out, find out where their local PNHP chapter is, and inquire, how can I get involved? What can I do to support this movement to get out and fight? We are absolutely looking to build our power to organize, and that means involving not just physicians, because there's only about 1 million plus physicians in this country, and while we have some power, we need a broad national movement to see this thing through. And so we certainly welcome working with allies, and we absolutely welcome non-physicians to join us in this fight.
And then give out a website where people can find out more about PNHP's work.
Yeah. So you can check us out at www.pnhp.org. And there you'll find resources, you will find the work that we've done, and you will be able to find people that you can get in touch with in your area to join this fight.
And that's pnhp.org. Philip, I want to thank you so much for joining us today.
Oh, it's been a real pleasure to chat with you again, Sonali. I really appreciate the invitation.
Thank you so much. My guest has been Dr. Philip Verhoef, an adult and pediatric ICU physician and clinical associate professor of medicine at the John A. Burns School of Medicine at University of Hawaii-Manoa. He's also the immediate past president and national board member of Physicians for a National Health Program. This is Rising Up for Justice, and I'm Sonali Kolhatkar, host and executive producer of this new weekly half-hour series exclusive to viewers of Free Speech TV and subscribers of my long-standing program, Rising Up with Sonali. Find out more at risingupwithsonali.com.